Hi, my name is Serra Cafelli.
My name is Quintin Brenner.
It's my husband and also my partner and caregiver throughout my NETS journey. To give you a little background, I was diagnosed with small bowel neuroendocrine cancer April 2024. It was found incidentally. I had a uterine fibroid that had been growing for the past 5 or 6 years, and I needed to get it removed. The surgeon at Duke said, okay, let's do a MRI, let's do a body scan to make sure everything else is okay. And that led to them finding a swollen lymph node near my ovary. And then that led to a PET scan, which then led to a liver biopsy. And then from there, it's just been a snowball effect. Yeah, roughly 30% of neuroendocrine patients have carcinoid symptoms. And I thought for me, oh, this is happening because I'm getting older in age. But, if any little blip, if you get redness, if you get whatever, just go to your doctor immediately. Unfortunately, I did neglect the doctor a little bit. But yeah, if you feel anything, I think the carcinoid symptoms should have been my warning sign, should have been my wake-up call, because unfortunately, some neuroendocrine patients can go even longer. And so since my diagnosis from April 2024, I immediately, my mom got me in touch with Lisa Yen, who's amazing, through NCF, and with Lisa's amazing connections and through NCF, I got surgery with Dr. Boudreau in New Orleans in November 2024. He removed part of my small bowel. They found 35 tumors there. They removed my ovary because there was a tumor there. I had a partial hysterectomy, and then they removed my uterus, and then they removed half my liver, appendix, gallbladder. That surgery was 6 hours. I was in the hospital for around 8 days. July 2025, Dr. Boudreau did the second part of my surgery where he removed 17 tumors that were sitting on my liver. Luckily, those were all grade 1. I'm technically grade 2 because the second half of my liver was less than 3%. But yeah, and ever since then, I've been on lanreotide. I think I've had 25 shots at this point. No real side effects from that. The only thing is that I'm on Creon right now, which has taken a bit to get used to, but I feel like I'm in really great shape. I've probably been in the best shape since college. Dealing with stage 4 cancer can be scary, especially this past week I had scans, and I was telling Quintin, my husband, that does make me feel like a cancer patient when I get these scans, but just having an amazing support system and just my family, friends, NCF, all these resources really bounces me back and makes me even more resilient to keep marching forward.
I guess coming from a caregiver perspective, I was obviously there for Sarah for both of her surgeries and stayed with her in the hospital. I think, it's just playing into the strengths that you have as a person and as your personality, identifying that and leveraging that as your caregiver role. For me, I think, and what I sort of reiterated in our vows when we got married was I like to sort of bring a sense of levity and lightness to a lot of these kind of hard to deal with situations. I think it helps Sarah kind of just deal with not the best news all the time. You're not always guaranteed to get the best news every time you go to a doctor visit. It helps her prepare for what might someday be not good news, but most of the time it is good news that you get.
Yeah, and another thing to add was that, when I was first diagnosed, they said I was inoperable. I'm seen locally at Duke for my shots and blood work, but then I got a second opinion with Dr. Woolen in New York, and then ultimately through Lisa Jens and the NCF group, they put me right in touch with Dr. Boudreau, and I probably wouldn't be here today if it wasn't for that. To have that such warm, welcoming community has really saved my life, to be honest. And being told I wasn't operable was scary, but having a surgeon like Dr. Boudreau who took me on and made me feel hopeful for the first time in a while. It is very scary at first to hear you have stage 4 cancer, but knowing that it's neuroendocrine and the more research that we did into it, even if it's grade 3, from my understanding that it's still slow growing, and using whatever resources that you have available to you, just take advantage of it. Speak to as many people as you can. Really, really urge you to go to the group, join the meetings if you can. I try to join every Wednesday, even if I don't have anything to contribute. I just want to listen and help people if I can, because it's not an easy thing. I never thought I'd be going through this in my 30s, and especially I didn't think Quintin would either, but it's making life interesting. And since the diagnosis, we got engaged, and then we also got married in Amsterdam, Netherlands, 3 weeks ago. So for me, that was just a really, really great thing to keep me going, the past 2 years, and just makes me really hopeful for the future, even though really sometimes it can be really scary to think about my future. In addition to planning our wedding for the past year and a half, I think it's also really important to maybe plan out little staycations or little weekend trips, maybe every 3 months. I just think having something fun on the horizon will also really help you be more motivated and hopeful for the future. Just have a support system ready by your side, have people go with you to the appointments, and also for them to have your MyChart logins is really helpful too, because for me, I don't like looking at my scans. And so yeah, just having a support system from the start really is very helpful.